Good evening and welcome to your favorite medical show, Ask Dr. Saw. As you know, this is a weekly show on the Guyanese Critic page here on TBN platforms. And you can join us every evening and send in your questions also. We've been doing the show, we're coming up to a year very soon, I think. Dr. Saw, we've been going for what, 10 or 11 months now? 10 months,
Yeah,
I think. Yeah.
September last year. So yeah,
Yeah,
of course, actually
right.
coming up the year.
Yeah, wow, it's a year so fast. So
Yeah.
thanks to all of you that have been joining us and sending your questions. Continue to do so. This evening, the topic is hair loss or alopecia, and Dr. Saw will be sharing his thoughts on that. Both of us got some hair, so we can't speak from much experience. But I have a little receding hairline at 50. But Dr. Saw, look, when I growing up as a child, I mean, you know, you always see people with bald heads, right? And I would always hear that that guy has bald head because he used to wear a hat. He used to wear a hat every day. Don't wear a hat in the sun. Is because his father was had bald head. The whole family got bald head, and all these kind of things you would hear. Not and I never paid attention to it. You either got here when you get older, you don't. That's how I
Sure.
saw it. As a young man growing up. And until very recently, when a known celebrity came out and spoke of this word alopecia, I never even know such a word exists. What is
Yeah.
alopecia, and are there different types of hair loss?
Yeah, of course there is. And of course, alopecia is a scientific word. The local word we know would say that you're bald, hair loss or baldness. I mean, you can lose hair without being totally bald, but when you're bald, I mean, there's no hair at that, wherever it is.
Yes, yes.
Now, however, there's a definition, and the definition is loss of hair density, that is thinning, or loss of coverage on the scalp or other parts of the body. So a very simple definition is either there is loss of density, so density is thickness, so loss of that will cause thinning, or there is a loss from the scalp or other parts of the body, or loss of coverage. So part of the body is not covered with hair. Now, that's your definition. And of course, I mean, there are many types of alopecia. So we don't say, right, your hair loss is due to, there's only one type, and that's a single condition. Like most diseases, there are different causes, there are different types, and all of that. And like that, alopecia has got classification. Now, simply, it is divided into two types. You have what we call scarring alopecia, and scarring means permanent damage of the hair follicle. So we know in our skin, under the skin, you have the hair follicle, the hair grows from that.
Right.
And so the two types you have is scarring and non-scarring. Scarring alopecia is where there's destruction of the hair follicle, so the hair can't grow back. And that happens usually due to what there's some skin condition, autoimmune condition that give rise to scarring. And commonly you heard of something called lupus. So there's a
Yes,
special type
yes.
of condition called discoid lupus, lichen planus, and patients who get born on their scalp or their body and it destroy the hair follicle. So that is scarring. The hair doesn't grow back, permanent damage. And then you have the most common, so that is not very common. And now you have the common type, which is called non-scarring alopecia. And that all now is divided into different types. So that is subdivided based on the pattern. So you have a diffuse type where it's spread all across the head. So that's diffuse non-scarring alopecia. And then you have a pattern type where it takes a pattern like receding hairline. That's a
Mm-hmm.
pattern. Both sides it's gone. It
Right, right.
creates a pattern. So that's a pattern type. And then you have what we call focal. So part, you may have noticed some people when you look at them, there's a patch of baldness, just an area. So just an area there's no hair, or even you get it on the beard, on your
Yes.
face.
Uh-huh.
You have a little round patch or oval patch or whatever it is, and that is
Yes.
called focal alopecia. Now I will go through that just to have clarity again. So you have scarring, non-scarring. Non-scarring is subdivided into diffuse, pattern type, and the focal type. Now, I will give you examples of the different types and how do we navigate our way through it and management and all of that. So I think that's in summary of what is alopecia and the different types.
Wow. So what causes it then, I have to ask? What causes alopecia?
Well, there is no one cause, and for the different types, there are different causes. So if we look, for example, the general what we call pathogenesis, that is what is happening chemically in the body. It is what we call the chemical bits that taking place in the body that cause you to get alopecia. We say it is multifactorial. That is, you have a genetic predisposition. So there's some genetic condition, gene responsible for alteration in the chemicals of the body, and it can give rise to that. You have a hormonal component. So it is blamed on high level of a hormone or the receptors for the hormone, alpha reductase, so testosterone type of hormone. Then you have immunologic, the immune system can attack like autoimmune disease, where the immune system attack the hair follicles and it damage the hair follicle. However, I mean, there are lots of other causes when we look at things like poor nutrition. So if you are malnourished, you can lose your hair because, like any cells of the body, you need nutrition for it to grow. So you're malnourished, you can lose your hair. There are certain medication we know. Simply, we all know that patients who having chemotherapy, for instance, like when you have cancer and you're taking chemotherapy drug, you'd lose your hair. We know stress. Patients are stressed and it could cause hair loss. What else? You have conditions like systemic disease, like thyroid problem, condition that affect the whole body. You're ill, endocrine problems, they can cause hair loss. And of course, if you have like skin conditions, psoriasis and certain infection in the scalp or skin condition, you can lose your hair. So those are the what we call the causes, pathogenesis, etiology. Those are the things that can give rise to hair loss.
I remember a couple of years back, they used to see a very popular ad. A couple of decades back, there was a popular ad that used to come up on TV, targeting men with hair loss. It was a popular thing called Rogaine with minoxidil. You would see this, and I would see,
Correct, correct.
and all there are lots of men, I can remember as far back as I can remember with bald head. Let's talk a little bit about that. Why do men, especially,
Sure.
why do yeah.
So that's a specific type now. So let us when I say there are different types, that is important. So not every type of hair loss they are treated the same way. You have to identify what type you've got. Now, male baldness, we call that male pattern baldness, or we call it androgenic baldness. And androgen is your testosterone.
Yeah.
And so it's called male pattern baldness or androgenic baldness. And classically, it's a gradual process. So as you get older, you have male pattern baldness. And the theory behind it, why do we get it? There is a genetic predisposition. So as you say, your family has got it. It runs in family. And there's a hormonal basis. So your testosterone is your male hormone, and it is converted to dihydrotestosterone. And they say that, and there's an enzyme called alpha reductase responsible for that. And there is a mismatch between the receptors and that hormone, or there's an increase in density of the receptors for these for that hormone or the alpha reductase. Now, that's a chemical basis of why men get it. So there's a hormonal element, and there is this genetic element. But it is very important to understand the nature of it because when we make a diagnosis of male pattern baldness, we would say, fine, there's no other cause. This is purely your genetics and your hormonal element to it, and we'll manage it by this way. Now, there's a classical pattern of it. So the pattern is you have receding hairline. So your hairline, your forehead goes back. You have temporal, bitemporal recession and the front line, or you can have the crown or what we
Right.
call the vortex or the crown. So you get
Yeah.
bald in the middle or you get receding front line or both you can have. Now that's your pattern. Now remember when I said earlier that the different type you have non-scarring. So this is a non-scarring type and this has got a pattern and it is androgenic or male pattern baldness. Now we see also it gets worse with age. So we know as you get older, it's more common. And also different ethnic groups. For instance, they say Caucasians, that's white, is greater than Asians, is greater than blacks. So
Okay.
black have got it the least, white have got it the most in that, order as such. But when it comes to management, if you're asking, can I give you something as a quick fix? It's difficult because, maybe lots of people wouldn't be walking around bald if it was so
True.
easy to treat.
Indeed.
However, it is managed by different ways. So I would go, let's say, the topical thing that regain. So I think some marketing say regain or Rogaine. It's
Okay.
minoxidil. So it's minoxidil is a chemical in it, and it's a foam or gel or whatever form you have it. It's topical, and you apply it there, and it is known to help hair growth. Now, that's one way of managing it. The second way is I mentioned that there is a hormonal element, your testosterone. So that's your male hormone. So we can also give a tablet to block testosterone. So it's
Oh,
called finasteride. So finasteride block the testosterone. Some of the downside is a low dose you give. So usually most people don't have side effects. But if I'm blocking your hormone, I can cause low libido,
right.
erectile dysfunction.
Yes.
So not everyone would opt for that way, but we know that if we give you that medication, it helps in slow the progression of your hair loss. What else you have? Now, yeah, so that's medication wise. And then, of course, you have wigs. You can hear wigs. So I'm looking at how do we manage it
Yeah,
generally.
yeah, yeah, yeah.
And last resort would be hair transplant. So it's your hair transplant. And hair transplants is common. I mean, now
Yeah,
we're
yeah.
more and more conscious. I have got lots of patients of mine. In the UK, we do lots of hair transplant. It is cheap other parts of the world as
Yeah.
well. And lots of people would go to, they've got big centers and it's a bit of a health tourism where people go on holiday to Turkey.
That's
And
right. I
they
got a friend who
have,
did it. I got a friend who New York who did it recently.
yes, where?
Mhm.
From Turkey?
Yeah, no, he went to Turkey and do it. Yeah.
That's correct. Yeah, on average, if patients, just for the information for the public, you can do your hair transplant for like $2,000.
Wow.
So it's not so expensive that it's unaffordable, and it works. I mean, I've got lots of patients I would recommend after we have gone through all the different types of hair loss, and we find that this is a male pattern hair loss. So it's very specific. That is classified as androgenic baldness or male pattern baldness.
Yeah. Well, while most times it's visible in men because we just go about with our days with it. Lots of women also complain about hair loss, and I mean I've known a lot of people who come and say, "Man, what do you think I should do? You should think I should apply something? You should I should cut my hair?" What causes that, and how do women manage it? And is it the
I
same?
mean, likewise, so they're different. In women, I mean, there are lots of other components in the different types. I think it is more common for women to get other types of hair loss, but there's a special type because, of course, women can have, they're more often they can have, because they're anemic, the nutritional status, they're having periods, and that can also contribute to their hair loss, that is their nutritional status. However, there's a special type of hair loss in women called androgenic alopecia as well, or female pattern hair loss. It's very specific in terms of when we make the diagnosis, we could say this is female pattern hair loss. Common types of hair loss in women would be female pattern hair loss, or they have something called telogen effluvium. I'll explain these terms in a bit. But you have female pattern hair loss, which is again like male pattern hair loss, where you lose frontal hair or thinning of the hair. So lots of time they have lots of thinning of the hair going on in the front and in the vortex or the crown. But the hallmark, because you can see it, there's a pattern. They have maintenance of the hairline. So in a man, the hairline recedes. In a woman, the hairline is maintained, and they lose hair from the front and the crown. So if you see that and you've excluded other causes of hair loss in a woman, you would say, fine, this is female pattern hair loss. And again, you manage it like male. However, we don't give them anti-testosterone as a tablet. We give them other tablet works as anti-androgen, because that finasteride I talk about, it's not, it has lots of side effects for women, so we don't give it to women. But you can give other anti-androgen, because the cause in women is not so clear-cut as the cause in men.
Okay.
As in when you test their hormones, it's normal, but still they have that. But we see they respond to drug to stop their hormone. Women can have high level of testosterone as well that can contribute. So patients who have got polycystic ovaries, they can have high testosterone level, which can contribute to hair loss. So we give, again, we'll start with topical stuff. So the same minoxidil or Regain, Rogaine, you apply that locally on the scalp. It causes hair growth. And there are drugs like anti-androgen, that is anti-testosterone drug, which we can give women. They're like a drug called spironolactone. It's a drug we used in other conditions like heart failure and blood pressure and things like that. So spironolactone, or there's a contraceptive pill that's got a drug called cyproterone acetate. Cyproterone acetate. It is found in a special type of contraceptive. So women who have got female pattern hair loss, the contraceptive is called Dianet. So they can ask their doctor for that. So that's female pattern hair loss in summary. Quickly, the other type that female get commonly is one called telogen effluvium. And telogen effluvium. So the story is our hair has got different phases. And telogen phase is a resting phase. Anagen is a growth phase. So the hair grows and then it rests. So in the telogen phase, it goes in that resting phase and then it is shed. You shed your hair and then you get the anagen phase comes up. So in our body, we've got about 10% of our hair. So a normal hair head would have about 100,000 hair.
Okay. Interesting.
And 90%, 90% of that is in the anagen phase, growth phase. 10% is in the telogen phase, which is a resting phase. But in this condition called telogen effluvium, you have a higher percentage is in the resting phase. You got about 30 to 40% can be in the resting phase. So normally you would lose about 100 hair per day in a normal person. But in this telogen effluvium state, you can lose about 30% of your hair and more. So instead of you losing 100, you lose about 300 hair a day.
Wow.
So you got more hair loss. So it's characterized by thinning of the hair. A woman would complain that I brush my hair and on the brush, there are lots of hair coming out. Now, usually that can be transient. So you have transient telogen effluvium. And also you can have chronic one that goes, it stays for long and it's difficult to treat. But importantly, we always look for a reversible cause. And the cause for telogen effluvium, one third of those cases, we don't know why you get it. But out of two-thirds, we can find causes. There are things like acute illnesses. So patients, let's say you have the flu. Patients who have had COVID, we found after COVID they've lost their hair. Any acute illness after surgery, patients go into hospital, they have an operation, they come out, they lose their hair. After delivery, these are the causes for telogen effluvium. So after delivery, thyroid problem, you have got low thyroid, you can lose your hair. There are lots of illness, generalized illness, low iron. I talked about women having periods, their iron is not optimized, they're anemic. You can have hair loss. And certain medication like beta blocker, antipsychotic, antidepressants, epileptic drugs. We talked about that last week. Cancer drugs. They all can cause lithium. They all can cause hair loss as well. So in that category of hair loss, where you have that diffuse telogen effluvium, you get diffuse like all over, you can have that hair loss.
I'm interested to know a little bit about, you mentioned about patchy or focal hair loss. What causes those?
Right. So it was interesting to show you a picture, but I don't know if I can share a screen.
We got about 10 minutes more. So yeah, we got you.
So okay, let me see if I can share a screen. How do I share? I go here, share, and then Google it, I suppose. Let's see if we can do that. What's going on there? Share. Let me see. Can you see that?
Yes.
No, I need to. Oh, I don't know what to do here. Well, let's go. Alopecia. So there's a patchy one called alopecia areata. Alopecia areata. So this is. I'm just gonna go on Google and share this. I look at the images in alopecia areata.
Right.
Wait. I want a Google picture, not necessarily that. What's that?
There we go. Yeah.
That's all right. Yes, there we go. Correct. So if you look at this here, this is called alopecia areata, so the focal type. So before we talk about the generalized hair loss, all parts or the pattern type where receding hairline. But then you have small patches of hair loss. And now this can be as a result of a condition special. In this case, this is called alopecia areata. Right. So I'll just stop sharing. I just wanted to show people.
Right.
You can get this there. You can get it on your beard. Let me see if you can find one on the beard itself. But they have different types of the alopecia areata. It can be alopecia totalis, like this guy has got it all over the scalp.
Right.
So I'll stop sharing that.
Yeah.
And get back to our screen. Now, okay. So in that focal type, there are many causes, other causes. So the alopecia areata is an autoimmune where the body attacks the hair follicle. And that is autoimmune. You find that patients can have other autoimmune disease like thyroid problem, pernicious anemia, and whatever else they have autoimmune disease. Management generally, we give, usually it goes back. We give steroids, so you can give topical steroid to apply on that area. Or there's an immune suppressant drug, tacrolimus or protopic. And if it doesn't get better, we then inject steroid into the skin, wherever it is. And then if that doesn't get better, there are now newer drugs in the market called biologics you can use. So that is your alopecia areata. Now also, patients who have ringworm, scalp condition, I talked about that as a cause of hair loss. So ringworm can give you these rings in your scalp and you lose hair. So that's another condition for these focal. So I'm looking at patches where you have focal. So be careful, if anyone has got that, they need to ensure that it's not ringworm. Importantly also, there are some patients who have psychiatric conditions where they pull the hair out. And that's called trichotillomania. Trichotillomania is a condition, a psychiatric condition, a mental health condition like severe depression and psychotic conditions where patients pull their hair out. is an obsessive compulsive disorder, and they just pull the hair out and you can get, bit. And also traction alopecia, certain hairstyle, you put weaving and you put these stuff, or ponytail, you put lots of pressure and you pull your hairline, and they can cause traction and extract, pressure on the hair follicle, and it pulls it out. So that's your focal type of alopecia.
Okay.
We talked about.
Well, can we? I mean, as we got about what, just over 5 minutes more to go. Can you summarize the approach to hair loss? That is the investigation and management of hair loss.
All right. So okay, quickly, because I think in summary, patients want to know, because sometimes we talk too much of different causes and patients are at loss, or the viewers, just for the viewers. So you come into the doctor, you say, "Doc, I've got hair loss." You'd say, "Look, I have," if it's a man, they may say, "Look, I have receding hairline, and this is all, my forehead is getting bigger, and or the middle of I have a bald patch in the middle." I can say clearly, without even doing any lots of tests, I can say clearly this is male pattern baldness. It runs in your family, and there's a hormonal element to this. And I will still do some investigation, because despite you having that form of hair loss, you can have nutritional deficiency that make it worse. So your thyroid must be low. You may have low iron or nutritional status, and would want to optimize all of that. So the progression is slower. But that's classic. In a female, likewise, if they come with a pattern type, I would say this is female pattern hair loss. But let's say most female will come, "Doctor, I brush my hair and I'm losing hair." So I may not see a specific pattern, because even in the pattern type, it may be not necessarily that one pattern. In the pattern type can be different. You can even have loss of the hairline. So in a woman, I'll be a little bit more looking for the telogen type of condition, telogen effluvium. I would want to then go and do some blood workup. So I want to know your iron level. Important. So there are two tests. If there's two things you should do, test for a woman with hair loss, or anybody with hair loss as such. You want to check their thyroid, and you want to check their anemic or their iron status. So you want to check their iron, you want to check the thyroid. And of course, if they have other systemic illness, acute illness, you would want to check that. And autoimmune. So if a patient presents to me, I normally go through a couple of things. If I see there's a pattern that I can identify, I say, fine, this is your pattern of hair loss. If I don't see a pattern that I can identify, I would run some tests to make sure I'm not missing anything. I'll do a hormone profile. I'll do your vitamin levels. I will check there are some vitamins that can be low, vitamin D, zinc, minerals as well, zinc and vitamin D, and some B vitamins. I want to check those to ensure it's adequate. I want to check your iron level, it's adequate. I want to check your thyroid level, it's adequate. And in the rare cases for scarring alopecia now, where the hair follicle is destroyed, you look at the hair and it looks smooth. You can't see these, dots, follicle type. That could be an autoimmune condition where the body attacks itself. So lupus related, lichen planus, we call it, discoid lupus, scleroderma. These are all autoimmune disease where the body attacks itself. So I will do an autoimmune test for that. Now that's your approach simply, and the management based on the type. We will talk about minoxidil, we'll talk about anti-hormone medication, and we'll talk about hair transplants.
I mean, you spoke about supplements and vitamins and so on just now. Does a special type of diet help with hair loss?
The general recommendation is not that you need a special diet. There isn't enough evidence to say this is the diet. Healthy diet, very important. You want to have a diet rich in micronutrients. So micronutrients, especially your B vitamins, your zinc, your vitamin D. There is also some evidence that lysine, an amino acid, helps hair. But on the contrary, if you take too much of a supplement, high level of zinc, vitamin A, they can cause hair loss. Biotin,
Yeah, yeah.
These are vitamins that can cause hair loss as well. So you want to optimize. That's why I will run tests to see if patients are low. You want to give them optimization of their nutrients. But yeah, so nothing beats a healthy diet. Flavonoids and polyphenols and all this diet that are related. I would, just want to encourage that.
Well,
Stop
I guess,
smoking, very
yeah.
important.
Well, I guess that,
Antioxidants, your berries and all of that.
yeah, yeah. I mean, I know, it's the one thing that that everybody here, we don't want to have it's it's kind of like hair loss is something that we don't we nobody wants that really.
Sure.
So
Well, it's cosmetic. Everyone
yeah,
wants to
yeah,
look good. You want to look young.
yeah, yeah.
When you're about all this, say, hey, you're old.
Yeah, Dr. Sa, I'm trying to get up the questions from last week here. I lost them on my
Okay,
phone.
quickly.
Just
Yeah.
but viewers, I just want to continue. I just want to encourage you to continue to send in your questions. To continue to send in your questions to us as we Dr. Sa will answer those questions. Um, and remember that you can, Dr. Sa, when will you be back in Guyana again? Because lots of people are calling and
Difficult
asking.
one, but I'll be back soon.
So again, thank you for all your questions. And now we go to the questions from last week. Dr. Saw, here is one of the questions we had from last week. Can you explain why your foot bottom gets cramps and feels like a wet long boots?
Yeah, that's. I suppose there are two things to that. Foot bottom crampy and it's cold. So wet long boots, I would imagine that person is feeling as if the foot is cold. So I always talked about a sensation. There are two things usually we look for when we have sensory or that coldness, alluding to blood flow. So the two things in the leg we are worried about would be blood flow and neurological condition. So if you have cramps, you have burning, it could be due to the nerve, so diabetics, neuropathy, or some nerve in the legs are affected. You can have sensory issues, so different feelings. Feeling cold um, can be due to less blood flowing to the feet or to the legs. So I think that patient should have their feet checked. So you want to check that the sensation is okay. You want to check that the power and they have movements normal. And you want to check if the pulses are intact. So in your foot, there are some pulses you feel if the blood flow is good. Otherwise, if there's none of that, you'd have to have some tests done. There are electrical tests we can do and ultrasound scan to see the blood flow. So it's a difficult to understand it in detail, but generally I think it's more to do with that type of feeling. And if you have cramps, you also want to check. Cramps are stiffen up or spasm of the muscle. You want to check for calcium levels, vitamin D levels, iron levels. These are the common things.
Okay. Next question is, Doc, is frothin, or as we call it in Ghana, frothing, associated with epilepsy?
Yes, invariably you would see patients when they're having a seizure, they would froth from the mouth, and there are various reasons for that. So during the seizure episodes, you're having movements of your muscle, tonic-clonic, you've got your mouth moving, and also there's an autonomic system. Your autonomic system secretes more saliva, and your swallowing mechanism is impaired. So you're secreting more, you're not, it's impaired swallowing, so you get more secretions in your mouth. And the movement of the jaw and the muscles, it mixes with air. So when air mixes with your saliva or your secretion from the mouth, it comes like a froth. So you have frothy presentation.
Okay. Next question is, Doc, you said not all seizures are epileptic. Does an abruptive appendix cause seizures?
What I meant there is an appendicitis, I would imagine, eruptive appendix or an appendix that inflamed. Very unlikely, to be honest, as a direct cause. I don't know. I don't know of any data that can tell me that the appendix itself is the cause for the seizure. But remember, when you have an appendix, burst appendix or something, you can get peritonitis or overwhelming infection. So if there is overwhelming infection in your body, the infection can go any part of your body. It gets into the blood, you're septic, you can get infection in the brain, you can have a seizure. Secondly, you can have high temperatures. So fever by itself, patients who are predisposed can trigger a seizure. You can have electrolyte abnormalities where the chemical in your body is all deranged. That can also cause seizure. But I wouldn't say that can be from any cause. It doesn't have to be appendix. So I don't think appendicitis itself is a cause, but complications around it can give rise to it. That's what my opinion. That's my opinion.
Okay. Next question is, Doc, can someone get a fit by looking at something gruesome or someone?
Are they saying if you look at an ugly person, you can get a fit?
Possibly. They might not be one
No,
look at the issue
I
anymore.
mean, it's no, that's just taking a banter. But
Yeah, yeah.
the thing is, if you're frightened, fear can give rise to seizure. So people who are predisposed, there are triggers. So I don't think if you are not epileptic or you don't suffer a seizure, you'd look at something and just have a seizure. But if you're predisposed that you are have a tendency for recurrent seizures, and these are triggers. So yes, if you're frightened and you look at something gruesome or any fear can give rise to it in some ways. But yeah.
Okay. Next question is, can some conventional drugs cause seizures in someone if used wrongfully?
Yes, we know the culprit of seizure drugs would be your stimulant type of drug, your psychotropic drugs, amphetamines and recreational drugs and all of that can cause seizure. But what that person is asking if normal conventional drugs for conditions. Generally, seizure as a side effect of the drug is not, a big cause. But if you overdose on a drug, any drug, you take overdose of your blood pressure medication, you can cause an electrolyte disturbance in your body. So lots of time patients, for instance, they are on diuretic water tablet. They take too much of it. They have, it changes your concentration of your chemical in your body. It can give rise to seizure. Antidepressant, quite often can cause you to have more low salt in your body. You have something called hyponatremia, and it causes seizures. So a certain conventional drug, wrongly used, overdose, of course, can give rise to derangement of your metabolic system. As we say, seizure can arise from the arrangement of your chemical imbalance.
Okay. Next question here. Doc, do you believe food should be the first medicine, especially an alkaline diet?
I mean, we always advocate for lifestyle, so diet and exercise. Anything we say for health, promotion of health, without medicine, diet and exercise is so important. Lifestyle.